What was training like?
So I thought it was fun and different from the one that we do here because I mentor and I precept nurses and advanced practice nurses here. The curriculum is definitely different in a way that in the Philippines there's emphasis on community health, and I think there is some here. They do have community health, but the community health there is different from what we do here. I used to recall during my training as a community health in community health nursing that we would go to the mountains. So there is a health center in different barrios. So in the Philippines, if you're familiar, and perhaps some of you, because you're still young, Dr. Dia would remember this, that how it's being set up is there's a city, there's a town, and the town has community centers, and there's barrios, and the barrios have a community center that is shared by many barrios. So we would be assigned to those community centers. Then there are programs that the health centers have established that we would promote and or some would even develop. And one of those programs, it's mostly, I would say, on health prevention and education. And what would we do would be vaccination, educating moms and how to take care of children. So reducing infant mortality is one, because during that time, infant mortality was high in the Philippines, including the place where I am in Cebu. And there was lots of transmissible disease, like for instance, dengue is an endemic problem in the Philippines then and until now. So I still recall doing those education programs and teaching parents and families about not only taking care of their children as well as preventing communicable diseases. One of those is dengue. So we would travel from the center that we belong, we would travel to the mountains and walk. And then Filipinos are so grateful. So that's why I love that community health nursing, because they're so grateful of what you have done. They're very simple people. So you might be in an neighborhood, what we call barangay, right? Because the town divided into different small barangays. So you would go there and you would talk to the barangay captain, and he would assemble, families, and then you would tell them what you're teaching for that day, or you would go home visit, because they're so grateful of you. They would give you like fruits, or in fact, one day I went back to the community center, dragging along a goat with me, because it was given. They gave me a goat, and for Pete's sake, how would a young nurse living in a Catholic dormitory have a goat in a dormitory? So I gave it to the medical officer of that clinic. So going back to your question, Elizabeth, it was really fun. It was fun to be in community health in the Philippines, because they know that they have that sincerity, that they just love you for what you did to them. I mean, you are not expecting it, but the gratitude that they give to you, it's like heartwarming.